Hello, this is Cushing Hu from pathology class doing my video presentation for week 2. So to start off with, the definition of disease is basically an abnormal condition that negatively affects the structure or function of one or more body systems in the body. It can be either acute or a chronic illness that someone acquires or is just born with. It's not a direct result of a physical injury. However, it does produce specific, unique symptoms or signs that are specific to that disease. So an example of a disease would be the common flu. So since each disease generally has specific symptoms or signs that characterize its pathology and identifiable etiology, we can use this to classify diseases. So aspects of disease that can help classify a disease are things like etiology, pathogenesis, morphological changes, clinical manifestations, diagnosis, and the clinical course. So an example of classifying the disease would be using this to differentiate between the common flu or the cold. So the common flu and the cold do overlap in many symptoms and signs. However, by using these different aspects of disease, we can eliminate different diseases that are specific to either the cold or flu to help determine what the patient has, if it's the common flu or the cold. So the etiology is the causation of the disease, what causes it in the first place. So most disease states don't have just one cause, it can have multiple different causes. So a lot of this will be biological agents, chemical agents, physical forces, or even things regarding your nutrition, whether an excess or a deficiency. An example of this would be a bacterial infection can cause the strep throat. So the pathogenesis is how a disease process evolves. Essentially, it's the progression of events from the initial etiological agent until signs or symptoms specific to the disease start showing up. So it's the beginning and progression of the disease. So an example of this would be in coronary artery disease, the progression of the inflammatory process from a fatty streak to the occlusive vessel lesion seen in people with coronary artery disease is the pathogenesis. So in diseases, there are specific symptoms or signs that are unique to every disease. So symptoms are the subjective complaint that's observed by the person with the disease. So outside parties can't see symptoms. An example of this would be headaches or dizziness, nausea even. Signs of a disease would be a manifestation that's observed by someone else. So outside parties can see this. An example of this would be swellness, jaundice, or even redness. The syndrome is the complication of signs and symptoms that are characteristic of a disease. So an example of this would be Down syndrome is a well-known genetic syndrome. Complications are any possible adverse extensions of a disease or even outcomes of the treatment for the disease. So bleeding after surgery would be a good example of a complication. The prognosis. So since pro means before, it uses your previous knowledge and the previous known factors to explain what will happen in the future. It is used to explain the most probable outcome and the most probable prospect of recovery after disease. So the prognosis for the flu, since it is a self-limiting disease, it should disappear within 5 to 7 days. Diagnostic media would be any experimental test that can help determine the presence of a disease. So these would just be any experimental or lab work that is done to help determine the presence of a disease. Example of this would be the catalase test. So this uses hydrogen peroxide as its main tool, and the presence of bubbles will be a positive catalase test, and this shows that the patient has a staph infection. And a negative catalase test will result in no bubbles, and that means that they have strep.